All right, so if you were here on the first day, which I suspect you were, my first presentation was about neuromuscular activation and enhancement of the physical performance and cognitive performance. But on the first day, mainly we were talking about the musculoskeletal system and all other systems as a whole. So today's my presentation is specifically dedicated to the brain, to the central nervous system, regeneration and neuroprotection. Specifically, what kind of peptides, brain-derived peptides, we have in our range that we can offer that can be used for neuroprotection and regeneration. So let's dive straight into the topic. The extracts from the cells from the following parts of the brain are available on the MO, mitochondria, or NLP non-organopeptides range. So in both of these ranges, MO you can find NLP range. You can find MO parietal lobe, which will be extracts from the cells of the parietal lobe cells, frontal lobe, occipital lobe, temporal lobe, cerebellum, and then there are combinations, same as there are combinations called antidepressant and beta sleep. There are combinations Parkinson's disease and dementia/Alzheimer's combo 1 and 2. And we will discuss in details what are the differences of these combinations and which one and when should be used. Yeah, just 3 minutes to fresh up the anatomy of the brain and the functionality, how it all assembled in our body. Just 3 minutes. Let's take a look.
What do they do? The brain controls everything that we do and how our body functions. It sends electrical messages along the spinal cord and the nerve fibers to all parts of our body. The nerve fibers also bring electrical messages back to the brain. The different areas of the brain control the different parts of our body. The largest part of the brain is called the cerebrum or forebrain. The cerebrum is divided into hemispheres, the left and the right hemisphere. The left hemisphere controls the right part of our body, and the right hemisphere controls the left part. Each hemisphere is further divided into 4 lobes. The frontal lobe controls our speech, problem solving, movement, personality and sensation.
This one an interesting moment. We are starting with the frontal lobe, right? And the frontal lobe already, the voice tells us what it's responsible for. First of all, it's speech, then processing of the movements. Also, it works in a high junction with the occipital lobe, with the cerebellum. Also, intelligence, also social behavior. So you can imagine that extracts from these parts of the brain can stimulate also development, not only regeneration or rejuvenation, but also development of those parts of the brain. So already you can kind of make a note in your memories that these extracts, these peptides, MO peptide of frontal lobe specifically, can be used also for therapies for children with autistic spectrum disorders, since this part is responsible for speech in a way, since it's also responsible for intelligence. So yeah, whatever functions of parts of the brain, of lobes we're gonna see now, those are the, again, therapeutic levers that can be manipulated.
The temporal lobe is where we process sounds and where our memories are stored. parietal lobe is where touch, temperature, and pain is processed. It's where we recognize objects and process information when people speak to us. The occipital lobe processes what we see. At the back of the brain is the cerebellum or hindbrain. The cerebellum controls our balance, posture, and coordination. The lower part of the brain is called the brain stem. It controls functions that we don't usually think about, such as breathing, sneezing, coughing, swallowing, and our heartbeat. In the middle of the brain are the pituitary gland and the pineal gland. The pituitary gland makes hormones that control lots of different body functions, such as our growth and the production of sperm and eggs. The pineal gland makes the hormone melatonin, which controls our sleep. Around the brain, we have a collection of bones called the skull and membranes called meninges. The meninges support and protect the brain. A clear fluid called cerebrospinal fluid runs between the meninges. The cerebrospinal fluid, or CSF, is made by tissues that line the brain ventricles. The CSF flows in and around the brain and the spinal cord. It protects them from injuries and provides nutrients. For more information about the brain and cancers that affect the brain or spinal cord, go to CRUK.
All right. All right. So the parietal lobe. We have MO parietal lobe, so that means that you can have a course of MO peptides injections 2 times per week, at least for 2 months, to improve the work of parietal lobe specifically. What is the function of the parietal lobe? This is very famous picture. I think you know what it represents. So in terms of parietal lobe, it represents the amount, the bigger the organ or the bigger the area, the bigger the amount of neurons that actually decode or encode sensations from these parts. So you can see a lot of sensors from the palm, from our fingers, also from the lips. We've got lots of different sensors to sense things and lots of neurons respectively. So the effects when we have this part of the brain damage, difficulty in recognizing objects by touch, spatial disorientation, trouble with left-right orientation, hemispatial neglect, and poor coordination. So all of these symptoms can be improved with administration of MO parietal lobe. Conditions that would benefit 100%: stroke of that area, Alzheimer's disease, and traumatic brain injury. Next one, frontal lobe. Very, very simply saying, simplifying in a high level, frontal lobe is responsible for intelligence. I wouldn't say if you take a course of frontal lobe, you will 100% improve your IQ for like 15 points and for 20 points. But if you are exercising in your intelligence, if you are studying something, or basically if you're exercising, if you're putting some efforts, frontal lobe peptides administration would significantly increase the rate of success of whatever you are doing. Same goes for kids with global developmental delay. Basically, all of them have get that like frontal lobe in the list of different types of cells that they get implanted and peptides that they get courses afterwards. Okay, so conditions that would 100% benefit: Parkinson's disease, frontotemporal dementia, ADHD, traumatic brain injury. Next one, occipital lobe. Everybody knows occipital lobe is the part of the brain that sees, that facilitates the vision abilities. And by the way, the eyes, actually, these are the only parts of the brain that are exposed to outer environment, because the rest of the brain, of course, is under the skull, but the eyes are those parts that actually face the outer environment. So yeah, obviously occipital lobe is responsible for visual processing, interpretation of the visual stimuli, object and face recognition. Cases to benefit: stroke or injury, posterior cortical atrophy, occipital lobe epilepsy, migraine. But we should also remember, like, okay, you would think that if you want to improve the vision, right? You could use the peptides of occipital lobe. Yes, 100%. But you would address only that part of the visual process, which is the last one step, decoding of the signal already inside of the occipital lobe. But before that signal gets there to be decoded, actually it goes through quite a number of structures, including structures of the brain, because basically this is the brain, which the signal goes through. Hence, if the vision is impaired, the impairment can be caused by the disruption on any part of this chain. So after the signal gets on the retina, through the eye, it goes through the optic nerve, optic chiasm, optic tract, lateral geniculate nucleus of thalamus, optic radiation, primary visual cortex, which is occipital lobe, and then visual association areas. Hence, this is why our combination MO, which is called beta vision, it's got not only occipital lobe inside of that formulation extracts, but also it's got extracts from optic nerve, optic tract, optic nerve, also retina. Also, interestingly enough, it's got even liver extracts from the liver cells, from hepatocytes, because still liver is believed to play a significant role even in the vision processes. Next, temporal lobe is all about hearing, but also temporal lobe is important for memories, specifically the way that we process the hearing information, right, the sound information, the way we perceive it, the way we process it, the way we memorize it, depends on the temporal lobe function. And also, as you can see, emotional instability or aggression, memory problems associated with short-term memory, and understanding of spoken words. So these are also therapeutic levers for kids with global developmental delay. Other conditions: Alzheimer's, temporal lobe epilepsy, herpes simplex, encephalitis. Cerebellum. Cerebellum is responsible for balance, for our movements, of course. Obviously, Parkinson's disease is the one that most vivid manifestation of occipital lobe compromised work. So related conditions: multiple sclerosis, cerebral ataxia, alcohol-related cerebral degeneration, Also, you might have seen some videos with later stages of alcoholic degenerative diseases. So those people have essential tremor, which is a sign of cerebral degeneration. Stroke in cerebral arteries, Parkinson's disease, obviously. Which is why we have also developed the formulation, a combination of these mitochondrial peptides, but also non-organopeptides. So you can find this formulation in both MO and NOP. Parkinson's disease, dementia combo 1, dementia combo 2. So Parkinson's disease, everyone's quite familiar with the mechanism, with the main problems, main issues. So obviously this is dopamine production, and as a result, tremor. Parts of the central nervous system that are directly involved with this condition is substantia nigra, striatum, thalamus, and frontal lobe. Hence, our MO Parkinson's disease would include extracts from the frontal lobe, from the frontal cortex, basal ganglia, specifically substantia nigra, and thalamus. This is the combination of the Parkinson disease peptides. This is NLP, but also you can find MO. For dementia, we can remind ourselves that dementia is actually a big umbrella of different types of neurodegenerative manifestations, including but not limited to Alzheimer's disease, which is also kind of dementia, vascular dementia, Parkinson's disease, also recognized as dementia, Lewy bodies dementia, and so on and so forth. So the areas of the brain that are involved are usually frontal lobe, temporal lobe, parietal lobe, occipital lobe, limbic system, which includes hippocampus, amygdala, hypothalamus, thalamus, basal ganglia. So because of there are so many different types and obviously different causes and different consequences of how much the tissues are degenerated, there are two types: dementia Alzheimer's combo 1 and dementia Alzheimer's combo 2. So combo 1 contains frontal lobe, prefrontal cortex, corpus callosum, cerebellum, and thalamus, which is quite wide, right? And it covers most of the parts for most of the types of dementia. But also, if there is some more specific presentation of the symptoms or some specific type of dementia, some types may benefit more from regeneration of amygdala, hippocampus, and cingulate gyrus specifically. Also, this one could be used for initial stages of manifestation. Also, with the same principle, with the same methodology, you can find hormonal support. We have already discussed it, and my colleagues also have mentioned quite a lot. So hypothalamus, pituitary, adrenal axis, hypothalamus as the center of the brain that collects all the information on the hormones levels in the body at the moment of time. Pituitary gland, which produces trophic hormones that make or trigger the rest of the glands to secrete the hormone itself. So HPA axis, male and female formulation, more complex is male and female fertility, which has not only HPA axis, covers not only HPA axis, but also glands for hormone production, steroid hormones production. By the way, interesting fact, if you didn't know, all steroid hormones are produced by mitochondria, specifically and exclusively by mitochondria, all sex hormones. Yeah, more complex to cover male-female revitalization. So this one combination already contains a lot, like plus brain, plus placenta, thymus, the immune system, mesenchyme, cartilage, synovial for musculoskeletal system, heart, liver, bone, fetal total. This is combination of all types of tissues from the whole fetal material, and spleen also for immune system. So here they even immune system and musculoskeletal system and metabolic system in addition to the hormonal system initially. Right, and with the same concept, we have this formulation for immune system, specifically influenza, or you can also refer to as COVID. Immune booster, recovery booster, and post-recovery booster. So immune booster, the first one, can be used when there is some kind of infection going on and you want to prevent, and protect to increase, to alert up the immune system, improve. You can use thymic peptides in combination with super transfer factor. This is like a cheat code, like adaptive immunity system, which was introduced from other host, and that other host has already acquired this immune system keys that they know it can be used as adaptive immune system. Yeah, so this is like a copy of those keys. Lymph nodes, mesenchyme. Now recovery booster is already after the condition has finished, after you had fever, whatever. So after you get healthy, so to say, after the manifestation, you can use thymus, lungs, heart, central nervous system just to boost up the regeneration, like restoration after the sickness. And then emergency post-recovery booster, even more of the systems are covered. So pituitary gland, adrenal cortex, this is HPA, hypothalamus pituitary adrenal axis. So in addition to heart, lungs, placenta and mesenchyme for regeneration, central nervous system, pituitary gland and adrenal cortex also covers the hormonal balance. Yeah, and that's all about the brain peptides from me for today. Thank you very much for your attention. For any questions, I'm ready to answer. Thank you. Yes, please. Why a nebulizer? Very good question. Thank you so much. Yeah. Yeah. Very good question. Actually, I was going to touch this topic. Thank you very much for reminding. What does it mean, MO and NOP? These are two different ranges. Long story short, there is difference in price, difference in effectiveness, difference in molecule weight and size, also difference in types of administration. So MO, it is more potent. The molecules are bigger. So the combination of these extracts in MO form can be administered only intramuscularly or intravenously, but that's the very specific cases. So usually administered intramuscularly, sometimes locally for the joints, if it's periarticular injection using cartilage synovia or mesenchyme or placenta. But all other cases and systemic effect is achieved by intramuscular injection, of course. MO can be done only intramuscularly. Now, NOP range, you can find the same combination, the same extracts in NOP range. This is nano-organopeptides. So the molecules, the extracts of these tissues are very, very small, nano-sized. Because they are nano-sized, they are not as effective. The effect is not that strong, which has some benefits. Benefits number one, much easier processed by the tissues. So First of all, the allergic reactions almost never comes with NLP. Sometimes you can get slight allergies with MO because big molecule, especially if it's let's say mesotherapy, there can be some transitory swallowness. With NLP, it doesn't happen. And the second advantage is nano-sized molecules are much easier to deliver. Starting from the just topical application, this nano-sized 3 nanometers molecules can easily penetrate through skin pores. Exactly. Second route of administration, sublingual. Yes. So if people are eager to take this course, for example, pandemic emergency booster, but they don't really want to do intramuscular injections, yes, they can do sublingually, NLP sublingual. But maybe they would have to do it 3 times per week or 4 times per week, not just 2 as here. Because bioavailability is lower, the efficacy is lower. So, but both of these therapies, peptide therapies, they have cumulative effect. So you just have to do higher amount of administrations sublingually. Also can be taken intranasally. Also can be taken as eye drops. If there is macular degeneration, for example, any kind of degenerative disorders inside the eye, usually we recommend also eye retina NLP eye drops. They work very nicely. So yeah, answering your questions, if it is NLP range, can be taken sublingually. If it is MO, only intramuscular administration. Any other questions? No? Okay. Thank you very much for your attention.